Thank you very much. My name is Tasha, Fuson, Associate Superintendent for Educational Services for the Carson City School District. Joining me today, I have Jason Zona next to me. He is the principal of Pioneer Academy. Next to Jason is Christy McGill. She is the Deputy Superintendent for Educator Effectiveness and Family Engagement for the Nevada Department of Education. And last on our panel over there is Dr. Medina. He is the Director of Assessment and Accountability for the Carson City School District. So our intent was to be able to provide kind of an overall view of what the critical issues look like from the state level, as well as the district level, as well as the individual site level. So I'm very happy to have my panel members here to join me to talk about this. In your packets, you were given some green copies of Governor Lombardo's a statement on the results of statewide education audit. So he commissioned an audit. It was 146 pages long. You just got a little synopsis, which is a good thing. But there was 3 things that were identified as key findings. The first one was the importance of eliminating fragmented oversight. So currently there are numerous boards and commissions with various duties and oversight responsibilities related to K-12 education. The audit found that these efforts need to be unified and uniform. I think we would all agree with that up here, so we're not going to really focus on that one. But as you all know, I'm sure for individual areas, it's nice if you have unified and uniform expectations versus being pulled apart in many different directions. The second one was the importance of maximizing K-12 dollars. Again, we all agree on that as well. Unfortunately, it seems like there was drastic amounts of money that were added to education, and there was. But when you consider the cost of raises and the fact that we are a very staff-heavy type of industry, then there really wasn't a lot of room for an increase in programming. But I think that's kind of a different conversation for a different day as well. So what we really want to focus on is that third bullet. So the importance of reinstituting critical literacy benchmarks via grade by grade 3. And we're going to kind of broaden that to really talk about more academic outcomes for students and the challenges behind what is causing the lower student outcomes when it comes to academics. So in our district, for instance, we did a root cause analysis and really dove into why have we seen since COVID our student test scores go down? Why have we seen less and less students scoring as proficient on, for instance, a math assessment or an SPAC assessment? And when we really tried to peel back the layers, one of the things that really stood out to us as a major issue, and that we're actually seeing as a national issue, is chronic absenteeism. So I'm going to give you a little bit of data on that to begin with. So pre-COVID, in our district, 15.3% of our kids were chronically absent. Chronically absent means they're missing 10% or more of the school year, regardless if they're excused absences or unexcused absences, right? That means 15.3% of students were missing more than 10% of the school year. That sounds high. I see some of you shaking your head. I agree with you. Here's alarming news, is in 2020, 2021, that went up to 40.9%. 40.9% of students in the Carson City School District were missing 10% of school, this 10% of the school days or more. Right? We're very fortunate that we are seeing in our district a slight downward trend from that, but last year it was still 28.8%. What about our state? Well, in the state of Nevada, pre-COVID, it was 18.8%. At the highest rate post-COVID, it was 36% in 2021-22, and last year it was 34.9. So little by little it's coming back. But when you think about that, we are literally still double the number of students who are missing 10% or more of school, right? Those days that they're supposed to be school in session. It's very difficult to teach children when they're not in school. So that's kind of what we wanted to focus on as the starting point for our conversation today. So I am going to actually turn some time over to Christy just to talk about, from a statewide perspective, what has the impact of COVID-19 been on attendance patterns statewide? What is that? What has been the ongoing issues that have occurred from that? Christy?
Nope. Okay, good afternoon. So happy to see so many of my fellow community members here on a Wednesday afternoon. So with chronic absenteeism, it's a fairly complex issue. And a couple things I want to reassure you all. One is that it is also a national issue. So when you are hearing some of those stats, if you look at the national level as well, 60% of our urban populations are experiencing chronically high absenteeism across the nation. Now, a couple things that make Nevada a little bit different. One is we've got slightly higher rates at 72%, but that it's not just an urban issue in Nevada, which is interesting. In the national, if you look at the national perspective, you see it as clearly an urban issue, more so than a rural. But here in Nevada, you see high absenteeism rates across rural towns, suburbs, and cities. So a little bit different, and why you see Carson City here also struggling with chronic absenteeism. So you're like, doesn't have to be that complicated of an issue. We just got to get kids to school, right? So there's a couple things going on right now that are complicating that. And number one is that more so than, and I see some, I saw some nurses in here, more than any other generation, this generation of children suffer from chronic illness. So what does that look like? Whether it's from autism, mental health, diabetes, asthma. So this is a reality that was not a reality a couple of decades ago. And so how is our education systems going to look at how do we teach children that may need to leave the school for health issues? And what does that look like, and those kinds of things. So that's one complicating factor. The next factor really has to do with the pandemic. So this was already starting to occur in the pandemic, but what the pandemic taught us is that kids, students, teachers can teach in a digital environment. And so they got used to that flexibility and coming back, and parents are like, hey, my child has asthma, they have a little bit of a cold, they're gonna stay home, they're gonna work, we're gonna do the digital platform. So that's a complicating issue. And then coming out of the pandemic as well, we have a new norm. It used to be like you got to school if you had the sniffles and all that kind of stuff. And now our parents are being asked, like, if your child's sick, we would appreciate it if they stay home. So that's a pretty big and fast cultural shift. So in some ways, our chronic absenteeism systems are really going to have to start changing to reflect those times as well. So the other piece is the mental health component, and that is also part of that chronic disease. So not only has asthma gone up, but so has anxiety gone up. And so this is across the nation. So when you really start to look at it, more health services are needed than ever before, literally located in our school. Indeed, nationwide, 80% of our student population get their mental health services from schools. Nevada, we are working to kind of catch up and make sure we have those services located in our schools. That's where the students are for a significant portion of their time. And we're finding that as we bring those services in a multi-tiered approach, that absenteeism decreases. So when they kind of have some of their needs met, and they have good school nurses, and they have good behavioralists, and we have school counselors to the ratios, we find that chronic absenteeism starts to reduce.
Yeah. So Tasha, can you hear me?
Yep.
Yeah. So Tasha had asked me to talk about kind of chronic absenteeism from the district perspective. Yeah, we'll do that one. Is that better?
There you go.
Yes. Yeah, so Tasha asked me to talk about chronic absenteeism from the district perspective. And if you think about Carson City, we have around 7,500 kids. If we look at the data today, we have about 1,500 that are currently chronically absent this year. And that number will fluctuate a little bit as the year goes on. But at least 1,500 kiddos have missed at least one day every 2 weeks. And if you put that into year terms, by the time those kids, if they continue to miss at that rate, by the time they reach the 10th grade, they will have missed a full year of instruction. And that's assuming that they've missed the minimum amount of days required to become chronically absent. We have a lot of kids that have missed a lot more than that 18 days. And the reasons for why kids are missing, there's a plethora of reasons. And when we think about like mental health, or when we think about all these different reasons why kids miss, it's often not just one reason. When you look at an individual kid, they might have 3 or 4 factors that are contributing to why they're not coming to school regularly. And it has affected all of our populations. So even our kids that typically before the pandemic were coming to school regularly, we got really good during the pandemic. If you were sick, it was like, stay home. We don't want you to come to school. Don't come and infect other kids. And so some of that is carried over. Or kids that before, if you had a stomach ache, you probably would have went to school. Now it's more likely that you're going to stay at home. We talked about earlier about some of the housing issues. Things are really expensive. And so we have a lot more kids that are kind of working. They have to do some things to help kind of support their family. When we talk about doctors and medical visits, there's a lot of folks that are doing the right things. They're taking their kids to the doctor so that they get better faster, so they get back to school. But a lot of times those appointments are during the school day. There's not a lot of opportunities for kids to go to the doctor outside after in the afternoon, after 3 o'clock, when they're not supposed to be in school. And so we're seeing kind of the reasons for kids missing school. It's across the board. And there's a variety of different reasons. It's not just one thing. If I think about before the pandemic, you could think about like the hospital. When you go there, you go see the triage nurse, and they figure out what's wrong with you, and they figure out who to help first and who needs what first. Right now, with 1,500 kids, our school system is overwhelmed. So we're not even able to really triage right now. It's kind of like there's so many kids that we need to do a million things all at once. And the students are struggling, but so are our teachers and our office staff. They're trying to figure out what can we do to support these kiddos, and they're kind of burning themselves out as well. I'll pass it over to you, Jason.
Good evening. So from the principal level or the site, we're at an alternative school, so we were already challenged with attendance and all of that prior the pandemic. And then that happens. Obviously, we were able to be flexible, bring kids back in quicker, but we still are challenged with attendance. And I think, like what was already said, we have to get to the reasons why. And so if we just have punitive measures, that really doesn't work. And there's only so many layers that educators can do to get kids to come to school. We really need to reach out to the community and the parents and families and have them help us as well. It's kind of like an injury for a really high-performing athlete. Our whole society was injured economically, physically, mentally, and so now we're not just back on that track right away. We need to get back to where we were and then go farther. You know, some athletes can get stronger after an injury. I'm optimistic we can do that, but we have to change our ways a bit. And since the pandemic, we have been changing with discipline procedures and attendance incentives. So just for some examples, probably skipping ahead, we tie a lot of things that we do extra at school to attendance. So for instance, the prom. If you're at a certain level, it's free to come. You know, certain things, we want everything to guide towards coming to school. Open campus lunch, you can earn it with grades and attendance. So every little thing we used to do just willy-nilly, we're learning that we can tie it to what we need to focus on. And once we get them to the schools, we can handle that. It's getting them there so we can make those changes.
Thank you. I'd like to spend a little time diving a little bit more into mental health, because you've all spoken about mental health and the issues that that's creating on our school campuses. We heard about that in the first panel today, and the challenges that even our community partners have been experiencing with increased needs for school-aged children. So for our school district, for instance, for the Carson City School District, we received additional funding about 9 years ago. The state really did a push on social workers in schools, or safe schools professionals is actually what they were called as a full-on title. In the Carson City School District, we focused on specifically social workers. And so all of our schools have at least one social worker. The high school, Carson High School, has 3. Now that means very large student to social worker ratios, but we do also have school counselors in the middle schools and the high schools. So we've been working really hard with our, we consider them mental health workers within our schools to help provide the supports and services for students. But in addition to that, we have actually really worked closely, as Christy had talked about. The Office of State has had this, and to be able to help districts be able to meet the needs of students in addressing their mental health concerns, to build up our ability to do that. So as a district, we applied for a Project Aware grant 3 years ago, and through that grant, as a district, we've been able to work with outside providers to actually provide clinical counseling to students during school hours for students who are in need of that service. I'm going to be honest with you, our outside providers are booked. So we've run out of the ability to use outside providers, so we have now invested, just recently, 2 days ago, we hired a full-time LCSW, licensed clinical social worker, in-house within our district to then try to fill in those gaps of us trying to be able to access outside support for our students. So we continue to work on building our ability to bring those services to our students within the school buildings themselves. So that is a need that we're seeing, and again, I think that's something that we're seeing nationwide. But Christy, do you want to talk a little bit about some of the Department of Ed efforts to address that and support districts around mental health for students?
Yeah, absolutely. First of all, I want to start off with this generation of students, and I hope you all have the pleasure to know them in some way. And you will see that they're pretty amazing. And one of the things, they survived the pandemic. So, a lot of what they know, what their life was kind of upended, and they went through it, and they're back at school, most of them. So kudos. The other piece is they're really fluent about their own and their peers' mental health. They are not, they don't have the stigma as much as like my generation did about talking about their own mental health. And so I really see a whole lot of hope in them, like peer-to-peer support. What we find is that, especially through the pandemic, that it was the peers utilizing things like Safe Voice, 988, calling about their friends and saying, hey, I'm really worried. They posted on social media, or they're saying goodbye, and these kinds of things. So they really kept each other safe. So I did want to start off with a real positive. This generation still struggles, though. Suicide is the second leading cause of death in our student population here in Nevada. And it is also one of the main tips. Suicidality is one of the main tips that our 24/7 Safe Voice line gets. It's the second most common call. So this, this population is really struggling with some of the mental health, anxiety, those kinds of things. One of the things I want to talk to you about is that many of your schools are already doing interventions and supporting students' mental health in schools. The problem is that here in Nevada, we only utilize education dollars to fund our schools. And so our schools not only have to pay for their teachers, their school counselors, their school social workers, they also have to pay for those mental health services. So one of the things we're really trying to do is to for students that qualify is to bring in Medicaid dollars into our schools. So if 80% of our students or so are getting services in the school-based arena, we should be aligning Medicaid and not just using our precious state education dollars to fund those. And so we've made some good strides on the systems level. We've allowed for the districts to be able to bill for Medicaid. We've also expanded coverage of school health services to all eligible students. And that includes screening and diagnostic services, psychological services, nursing services. So some of the same things that you would get at a doctor's office can now, and if the schools are already doing it, they can be billing for it. And you might be saying, but why are schools doing this? So one of the things that schools cannot do is they cannot place our students on a wait list. They must educate every child. It does not matter if that child was suicidal that day. That child is welcomed into all of our schools. And so there are things that your schools are doing right now that you may not even know about. So the school counselors and school social workers are putting and helping parents and kids to come up with stabilization plans. Those are the types of services that we're talking about that can be billed for Medicaid and be allow the districts to offset those costs, not on educational dollars, but on Medicaid dollars as well. Nevada Medicaid is going to each district to discuss with them how can we bring more of these federal dollars into their schools. And then they're also really looking at, they just applied for several projects, and how do we make this simpler for the districts, right? The districts were never set up to be clinics, and we do not want clinical services out of them, but there's some sort of hybrid there. There's that public health community services that are going on in our schools right now that probably education dollars should not be funding. They should be coming from the Medicaid system. Sorry.
And I think that Christy kind of alluded to kind of a big change that has happened in education over the past couple of decades. If you think about it, you have educators that are up here, and we're not talking about like reading, writing, and arithmetic. Like we started off talking about the governor's proposal with Read by 3. That used to be like the main purpose of what folks in education did. But I think over time there's been this shift where now schools are kind of tasked with doing a lot more than just that reading, writing, and arithmetic. We have to focus, we have to meet the needs of our special ed students, our students that don't speak English, but we also have to focus now on mental health, discipline issues that we never, it used to be like if kids got in trouble, you kind of sent them away. Like graduation rates, if we look back like 30 years, they were down in like the 50% range. And so as we've held on to more of our kiddos, we've realized that there's a lot more services that we need to provide. And if we even looked at like before the pandemic, some of the if you look at like what educators got trained on, like when we went to school to get our degrees, it was that reading, writing, arithmetic piece. I never took a class on mental health. I never really took a class that was devoted solely to discipline or devoted to how do I get kids to attend schools. It was kind of just assumed that the kids would show up and be ready to learn. And so we've also had to make some adjustments post-pandemic on some of our like discipline procedures or mental health procedures. So it's not just about providing punishments to kids when they don't come to school. We have to figure out what are those root causes, why are they not coming, so that we can provide some of those supports so that we can make them want to come to school. And when they're not able to come to school and they have really good reasons, how do we help them take down some of those barriers so that they are able to come and focus on their education?
From the site level, a few years ago when we didn't have social workers, I can't imagine that now without that position. So we're very fortunate in Carson City to have one at every site. That allows, if I look at our social workers' doorway, it's a revolving door all day. And it's really an amazing thing. They cooperate with counselors, but counselors are really academic counselors in high schools. So that social worker piece is critical. like Ricky was saying, we really had to look at our suspension process and discipline and take a different look and have levels of intervention before someone just gets booted out. A lot of the attendance problems in the past were due to our own treatment of students when they didn't follow a rule. So when you look at that, those are things we can control. Can they stay in the building? Can they go to a different classroom and cool down? Can they talk to the social worker? There's a lot of different steps we have now that we didn't used to have. So if anything has come that's good out of this, it's our way of doing business has changed quickly. So.
I think you're probably hearing a lot of parallelism again to what we heard first panel this morning, just about the necessity for not only our police officers, but also then for school systems and the hospitals exactly to figure out how to address the needs of our students and working together, or our community members, even adults. So in our district as well, one of the things that we've really noticed a need for is to actually help our parents as well. So we used to just be super student focused, right? As Dr. Medina said, our job was to teach reading, writing, and math. That's what we did, and we left the parenting up to the parents. And students didn't behave, then we suspended them, and they got to go sit home with their parents, and the parents disciplined the children, and they come back the next day and they behave a little bit better. That's not what we're experiencing. So again, just the same as our partners earlier today, talked about the fact that we're trying to figure out how to not only serve the students but serve our families. So even within our district, we actually do have some contracted clinical psychologists that work with us that actually work directly with parents that are in crisis, so that we can help the parents then help their children. So we work all aspects. We offer parenting classes within our district, so that we can help our parents learn how to help their children with academics or setting boundaries. For instance, we just did a love and logic class for families last semester, and that is about how do you set boundaries for your child so that they're not staying up until 1 or 2 o'clock in the morning on social media. So we're having to diversify how we are meeting the needs of our students. And as you heard, that's again not just in our district, that's within our state, that's within the nation. And we're constantly looking for outside resources and funds. So again, when you hear that there's a lot of money being invested into education, I'm hoping what people are hearing is, well, we went from having the expectation that we taught reading, writing, and math, and now we're providing clinical social worker services within the schools. We're providing wraparound services for families. We're providing food to our students. We're feeding them 100% of our students twice a day. We're presenting food home on the weekends for our families. So there's just, education looks different than it did when most of you were in school, myself as well. So the other thing I wanted to talk about is widening of existing learning gaps and creations of new ones. The one thing that we saw a lot during COVID is the academic achievement gaps become larger between the students from low SES families versus middle income to high income families. We saw a lot of our families that were in crisis or in need, that they had higher levels of absenteeism. We do know that students and families that live in poverty are more apt to get sick, right? Because of not having nutritious food, not having proper health care, those things. But we actually saw much, instead of closing achievement gaps like we've been talking about for years and years and years, we saw a widening of those achievement gaps. So we've had to institute other services to address those issues as well. Do we want to talk about, let's actually start with you, Jason. What does that look like at Pioneer Academy? I actually want to point out that Pioneer, so Jason, being the principal of our alternative school, has had to be his staff have been very flexible with the needs of our students, because they actually started as a 9-12, and then through the pandemic and the need to be able to offer full-time online for students first grade up, they took on all of our full-time online kiddos first through 12th grade at that point in time. And then as we realized after we came back from COVID and being in a hybrid schedule and got students back in seat, our students in elementary school, you really just can't do online with elementary kids. If you see a first grader trying to sit in front of a computer all day long and have a teacher trying to keep their attention, it is something to behold. So we do not offer full-time online services for elementary anymore, but now, so Pioneer now offers services for kids in 6th grade through 12th grade. But do you want to talk a little bit about what that's looked like for your staff?
Sure. So online has evolved over the years. When we tried the elementary, that was a real challenge. I think what we've learned is it's stabilized. It was really popular at first, and then COVID happened, and now folks are getting back into a brick and mortar school where all the resources are. As far as the gaps, we've learned at our school to build in the interventions within the school day. We tried at first to make after school tutoring and before school, and we just couldn't get kids there. So we actually just lengthened our school day, got permission to do that a few years ago. We have the most instructional minutes with our bell schedule. Teachers are all on board with that one, and we really appreciate that. We put the electives that kids need within their school day as well, and they can also get more credit. So that's how we helped. Didn't solve the problem, but it did help move in the right direction. So that answered.
Yeah. The other one? Oh. Do you want to go first?
Sure. I think something that I would kind of say, because like right now, if you're on social media or you watch the news, education gets beat up every single day. And the one thing that I would say is that our expectations for students today are higher than they've ever been. If you look at the state assessments that students are required to take today compared to what we took when we were in school, students are expected to learn a lot more. And I would also argue that students that graduate today tend to be smarter than kids that graduated when I graduated from school. When I graduated from school, computers weren't as mainstream yet. I didn't have to know how to use a computer. I didn't have to know how to use an iPhone or any of those different types of technology. I didn't need to know anything about AI. So I think it's important to point that out, that those expectations, education, like the need for education hasn't gone down. It's not as popular as it was in the past, but those expectations are higher. And that means that, just like I said, our teachers are struggling. They have to not only teach arithmetic and English and everything else, but they're doing all these other things. For our students, it's that same thing. The expectation's higher, but now they're missing more and more school. So it's a compounding problem. If you're missing one day every 2 weeks, that adds up. It gets more and more difficult to overcome.
Yeah, absolutely. With this job, I get the pure joy of visiting many schools, and I can't tell you the level of enthusiasm I see at our students who are there, and also the level of dedication of the education field here in Nevada. It really blows your mind. So absolutely what he was just saying, like the expectations and those kinds of things. Now we still have some things we need to work on, and really it is the community coming together with the school is so important, and to make sure that we're not burning out our teachers. So some of that vitriol we see, it starts to translate down to the teachers. But the other way not to burn out teachers is to make sure that we have enough teachers in the classroom. So many of our teachers are starting to retire. They're getting to that age. Many of the students don't think about teaching as a profession. So one thing we can start doing is really starting to talk about kind of like how we did in the medical field of really making sure that people knew, like doctors, nurses, the need for that. We need to have that same conversation with our young people around teachers, because our young people are really amazing and they could probably make some really amazing teachers. So making sure we have good pathways to teachers. And then also to make sure that teachers have a team. We talked a lot about, and this is one thing that I know when we live in a community, we always like to say, schools aren't good and all that, but we've got some pretty good things happening here in Carson City, and you heard them today. You heard wraparound services. You heard focusing on parents, focusing on families. That's not happening everywhere like it is happening here. So I really hope we all embrace our schools here and support them as they move forward. And then last but not least, so digital and AI is going to change education, period. It already has, right? And a lot of people say, oh, all the information, all the content is on the phone. The big shift for education now is not just the content, it's the skills. These teachers now have to teach the skills of analysis, of how to collaborate, of how to do higher level thinking to infer whether data is correct or not correct. And so, I know we're going to go moving into this new age where so much of the content is now going to be in the hands of AI or digitalized or on our phone. And the students today may not be as connected to the content, but they're connected to their schools. And the reason they're connected to their schools, if you go into the schools, it's the one place these are not there. They're recesses, they're interacting with our teachers, they're interacting with each other. And so schools have become really important places for the child-to-child bond to foster and also for the adult-to-child bond to foster. And so, it's very exciting. And so, I know that, and we don't worry so much about AI and the digitalization of education, because that clear need for the adult-to-child bond and that child-to-child bond will be, and in some ways it's even becoming more important than calculus. But I want to leave you with this. So I was in a school, and it was a high school, and they were learning calculus, and I have to admit, I never learned calculus. And they said, we're not quite sure, but we have the skills now to figure this out. We're not sure quite how to apply it, but we have the skills to figure out how to do calculus. And I thought, that is exactly the kind of shift. It's no longer just the content that our students are focused on. They're focused on the skills of how they can get through their studies. And I think Carson City, you all have done a really good job. That's called competency-based learning, by the way, and they're doing a really great job moving that forward.
Thank you. The last kind of challenge I wanted to talk about before we move into, so what can we do next, or what can we do about it, is the disparity in the resources and opportunities for families. We kind of hit on this a little bit. I believe Dr. Medina was saying a little bit earlier, one of the challenges I know, for instance, when we talk to our families about why their children are missing school so much, they'll say, well, I can't get a dentist or a doctor appointment that's not during the school time. So then if I have to take the day off to take my child to the dentist, then I just don't bring them back. And we're like, no, we want you to bring them back. It's okay, right? Bring your child back. And also things like childcare. We hear about, especially in our city, and I know it's a problem outside of our city walls, but the lack of daycare and childcare for our families. So you may have heard, for instance, just recently this upcoming year, the Carson City School District has partnered with Boys and Girls Club to offer daycare services to, it's going to be targeted first at our employees, but if there's other open spots, it will go out to the community as well, that we're going to house in our student support services buildings, one of our school buildings. We are going to have 3 classrooms of daycare, because we are having a hard time maintaining teachers because they can't get people to watch their children if they have children under the age of 5, especially, right, not school age. So that's one of the challenges that we've had. And through COVID, we saw this a lot too. I mean, I know you've seen statewide, and Christy, I'm sure you can talk about this, but when we had to shift to remote learning, we were very fortunate as a county or as a district, because we were already a one-to-one district, but many of our fellow districts were not. So closed schools down, went to digital learning, but what did that look like, or was there such a thing as digital learning? It was mostly work packets, etc. And then many of our families didn't have access to Wi-Fi, for instance. So that was certain disparities for families being a challenge for us. Do you want to kind of address that? I know that the state has come up with, there's a lot of, again, funding support that you might want to share with everyone. That's a good thing.
Yeah, absolutely. So, daycare is always an issue. You all probably have connection with kids, so know how expensive it is. One of the governor's initiatives that he put forth this legislative session was a real emphasis on pre-K or early learning. So those 3 and 4-year-olds. One of the indicators that really improve a young person's educational attainment is really good pre-K, high quality pre-K services. And this governor put in millions of dollars for those pre-K services, and really working with NDE and the districts to make sure that we have the capacity to really stand up those additional pre-K services as needed. So that is happening right now, and we hope to continue to move that forward, and so that it's not finances that prevent a young family from engaging in high quality pre-K if they so choose.
And I'm gonna take it back to expectations. So my kids at home, I have 4 daughters. They know that education is important because me and their mom beat that into them every single day. We take them with us when we go to the university, we take them to libraries, but not every student has access to that. I grew up in the projects. Before I went to college, nobody in my neighborhood had ever gone to college. Nobody in my neighborhood had ever graduated from high school. And so we didn't think that education was important. It wasn't a priority. It wasn't something that we're good at. Like if you're good at something, you tend to like it. Like I'm decent at basketball, so I like to go and play basketball. Golf, I don't know how to play golf. I've never been to play golf. So if you ask me about golf, I'm going to tell you that it's stupid. And that same thing happens with our kids. And I think that our kids nowadays get a lot of mixed messages. If you watch the news, there's a million jobs out there. There's jobs out there for everybody. But nobody says that those are oftentimes tend to be entry-level jobs. That eventually you're going to meet somebody that you're going to fall in love with, and you're going to have children, and those people are expensive. And you're going to need some sort of education to fall back on to help you gain another credential so that you could kind of move up in the workforce. And I think sometimes our kiddos, they don't hear that information. So they think that school is totally optional. And I think that that's something that has kind of been a real detriment over the years, is that school has become something optional. It's no longer kind of like the basis of the American dream. It used to be if you go to school, if you stick with it, you could be successful in the United States. And I think some of that has kind of gone away. And I think that's something that we need to bring back. We need to talk about that with the kids that were around when you're with your nieces or nephews. Ask them how their school is going. Share with them why that's important. When you see some kid out on the streets during the school day, you're at Starbucks and they're at Starbucks and it's 1 o'clock in the afternoon and you know that they should be at school. Don't scold them. Just ask them kind of why they're choosing not to go to school, or share with them why you think it's important.
I don't have a lot of pre-K to add, but at an alternative school, we've really had some flexibility on field trips. So a lot of schools had restrictions at one point, and we have had good clearance to take kids and build that background knowledge, expose them to things they haven't seen, and that's really important. We kept that throughout, when we were Title I and not Title I, it goes back and forth, but we try to keep that culture at our school that you're not going to not go on a field trip to Apple or Tesla because you can't afford it. We're going to take everybody and they all get the same exposure.
Thank you for bringing that up, Jason. So that's one thing also that we're experiencing that I don't think sometimes our community realizes. We've had a real change in the demographics of our typical student for our district. 33% of our students are not native English speakers. So that means they're coming to school speaking a different language. That's not a negative, right? We have to look at that as a positive if we can help the student then learn a second language and learn skills in both languages, right? It's a positive thing to be bilingual. One of the challenges that we're also seeing is we're getting a lot of students that are coming from other places that are not literate in their native language as well. And that's a different situation of teaching a student who is fluent in their native language and also has literacy skills of reading and writing. It's a different approach to teaching that student because then you're teaching a language, but they already have the concept of literacy, versus when you have students that come in that don't speak English, they speak a different language, but yet they have zero literacy skills. So they don't know letter sound associations or how to read even at their grade level in their own language, if that makes sense. So that's a challenge that we're seeing significantly on the rise within our district. And it's not just students that are coming from Spanish-speaking households. You look at other more diverse areas, maybe San Francisco, and they'll tell you that they have 25 different languages and an equal representation of students from all those different languages. In the Carson City area, it was 99% of our second language students were Spanish speakers. Well, that's not the case anymore. We have 17 languages that are represented in our school district. Most recently, we've had students from Afghanistan that have come, and they don't have any school records, and we don't have the resources to even assess what their actual languages or what their functioning is, even in their home languages. So it's just a different challenge that we're seeing that we're having to also then try to navigate and figure out. I will tell you, like I said, we've been very fortunate in support from our state in terms of being able to get technology in the hands of all of our students. So for instance, in our district right now, we do utilize, as I said before, modular devices, because the great thing about being able to have access to online technology is a lot of it does have translation services for students. So it does help with our second language students. We also received federal funding to be able to provide Wi-Fi spots for our families in need. So no student in the Carson City School District has a need in terms of device and or Wi-Fi that we are not able to provide for. So those are very positive things that we've been able to do and help our students. So then that just kind of makes me want to kind of go into our next topic, and that is really, so what can we do moving forward? What are we currently doing moving forward? So we've talked about a lot of the challenges, but how are we as a district meeting those challenges? I did talk a little bit about the work that we're doing around mental health, but the other thing we've done, which has actually been expectation of the state or a practice of the state, is what is referred to as multi-tiered systems of support. That is something that our district has embraced in the last 3 years and jumped into the deep end in terms of training school sites, what that looks like. So within the multi-tiered systems of support process, we actually look at 3 different areas. We look at academics, we look at mental health, and we look at behavior. And you employ, for instance, at a regular school, regular grade level curriculum material, you're hoping to meet at least 80 to 85% of the needs of your students. If you don't, then you look at what interventions need to occur to help that student and you fill those learning gaps. All of our elementary schools have built-in intervention block time set aside. Jason mentioned that at his school too. We've acknowledged the need to actually do those interventions during the regularly scheduled school time. So we've been able to really do a lot of intensive training with staff about what that looks like. Our goal is always to keep the expectation of grade level standards, what they are, and to bring our students from where they're at up to that grade level. We talk a lot in our district about we don't want to love our kids to remediation. We don't, right? So yes, you may be a 3rd grader who's reading at a kindergarten level, but our goal is always that we want to try to get you up to grade level by the end of the school year. So what is it going to take for us to get you there? Versus saying, oh, okay, well, you read at 1st grade level, we're just going to hope to get you to 2nd grade level. As Dr. Medina said, if we did that, compounded with the issues that we have with attendance, and that student missing an entire year of school by the time they're in 10th grade, the students will literally get further and further and further behind. So we've invested a lot of resources into helping our schools get the training that they need to employ the multi-tiered systems of support processes within their schools. The other thing that we're trying to do is really trying to re-engage parents. So I'm going to invite my colleagues to talk about that. But I think one of the challenges that I've seen is through COVID, we weren't allowed to have families in the buildings, right? Because you were trying to keep 6 feet apart. We had little stickers on the floor like everyone else did. Kids had to keep 6 feet apart. We didn't have external people come into the buildings. And I think over the course of, believe it or not, it was only 15 months. But over the course of 15 months of time, somehow we changed the culture of our schools that our families did not feel welcome. And so we've been combating that for the past 2.5 years. How do we re-invite our families back into our schools so that they can have that connectivity with us, so that they can start to see the importance of the family-school partnership, but them being engaged in order to get their children engaged. So can we talk a little bit about family engagement? I don't know who wants to go first on this one.
Sure.
Okay.
So as an alternative school, we're pretty good about earning trust of our students. It takes a few months, obviously, and then they start believing that we believe in them. But we really haven't done that with families. And so the last couple of years, we've had a lot more family nights, whether it's painting and punch and pizza, bring the families in. We have to do the same thing with them and earn their trust. When they work with us as a team, the kids are going to win a lot quicker. And so that's something we've shifted, not just earn the trust of the students, they're there with us every day, but really invite the families in. And as you know, typically elementary school parents are there a lot. It dwindles a little bit by middle school, and then by high school, it's even farther out. So we're trying to reverse that in our place.
Yeah, and I think that Jason kind of hit on the important point. I think the relationships, building that trust with both the student as well as the parents. And I look at that building trust with parents, I look at it as, first off, I have to accept that not every parent is going to be a parent just like me. That different parents have different parenting styles, different kind of abilities. And I look at it kind of like the uncle that nobody in the family gets along with. Like, we're going to have to put up with that uncle. He's going to come every Thanksgiving. He's going to come every Christmas. We could either fight with him and both of us be miserable, or we could accept the fact that he's different and kind of provide him some different accommodations. Understand that, yeah, maybe he's not going to sit at the main table with everybody else. He wants to sit alone in the living room. And some of those things we're just going to have to accept. And so for some of our parents, they might not have all of the resources that we expect them to have. So we might have to find some additional accommodations to provide a little bit support that's sometimes outside of the box. Now, that doesn't mean that we're going to allow them to give up all of their parenting responsibility. There's some non-negotiables that we're going to expect them to still adhere to. But if there's something that we could do to make it easier to remove some of those barriers for their kids to come to school, if I have to purchase a kid an alarm clock so that way they can set an alarm so that they get to school, some of those things, we might not have done them in the past, but we're looking at different things that we can do moving forward to be more supportive of the parents that we have and accept the fact that they're not going to go away. They're going to be a part of our system, and we're going to have to find ways to live together and support each other, because I've never met a parent that didn't believe that their kid's the most important thing in the world. They might not have the skills or know what to do to help their student to be successful, but they have that desire. And if we're working together as a team, both of us are going to be successful.
Yeah, I think parent and community engagement is one of the most important components the school can invest in. And the reason being, as we just kind of talked about it, is that the education system has become extremely complex. It's no longer just the content, right? Content's on the phone, content's in the computer, content's in AI. We're talking about, we want to make sure that we are teaching the skills that these students need for the future. So in order for that to happen, that partnership between the parent and the student and the school becomes really important. And then also some of the assets that the community brings can really impact as well. So I've seen schools start to embrace the multilingual component. And so that the goal is from pre-K to third grade, because that's when humans learn language, they focus on that second language learning. So it doesn't matter if you come into the school just speaking English or just speaking Spanish. By third grade, they want both students speaking both English and Spanish. And it is an asset for both students. So those kinds of things, that work, that teamwork with the parents and the schools, those are the kinds of innovative approaches that parents and teachers can do together. The other piece is community. So I think we used to have this notion that you drop off the kids and the teachers would do their magic and then you pick them up. Well, again, it's becoming more complicated. And so we have some models where local hospitals or local doctor's offices are literally putting staff in the schools themselves or working along the school to make sure that the providers are in the schools themselves. Because again, so much of the prevention and health is taught on a daily basis. And so that creative kind of out-of-the-box thinking of how do we as a society meet some of the challenges, and many people look to our schools to do that. What we're learning is that teachers can't do it on their own. So embracing that teaming approach, not only with the parents, but with the community as well. And you see that here in Carson City. So they have the coalition here. They have parent nights where it's not just the school, it is the community organizations that are coming in as well. So that team approach, I think, is really, really important. Schools, I think we've all come to the realization, one of the things the pandemic did is we've realized that schools cannot do this independently. Schools are deeply rooted in our communities, and our parents are deeply rooted in those communities. And so to work separate, it's just not efficient and it's not going to work anymore. And so making sure we have those things. It's also a component now to school improvement planning. So making sure that, it's part of the policies that at the state we look at and see how we can support the districts, is to make sure that the very important goal of, how do we improve the school to make sure that they have everything they need to work with the parents side by side, and to look at some of those innovations I just talked about, reversing the language acquisition from it used to be that you got that second language at high school. And now we're really seeing that, wow, that needs to happen in pre-K through third grade where they're, doing that language. And how do we do this? And how do we bring in the community? And how do we make sure that everyone graduates with 2 languages? So I think there's some really exciting things that are happening out there. I guess my key takeaway is that the schools can't do it themselves. It really is going to be like community members like yourself working alongside them.
Thank you. I want to build on that community and partnership part 2. To kind of go back to that MTS framework that I was talking about, what that looks like. And I think it's important to me that our community members have an actual picture in their head of what this looks like for schools and how we partner with external partners when necessary to meet the needs of our kids. So again, in an MTSS framework, we're hoping that what we do on a daily basis is going to meet the needs of 80 to 85% of our students. But then we have to have screening processes, right, to determine our academics weren't working. If you've heard of the MAPS assessment, the measure of academic progress, your kids may have come home and said, I have to take my MAPS test. Right. Well, that is how we do universal screening for our students in our district from kinder through 8th grade. So it's done. It's administered 3 times a year, and we look at student progress, whether or not they're growing, and whether or not they're meeting grade level expectations. If they're not, then we identify those students in need of extra support and interventions. As I've spoken earlier about the fact that all of our schools have that built-in time now, and students are putting those intervention blocks. And then we track whether or not they're responding to the interventions that we're giving them at that point in time. If they don't respond to interventions at that level, for academics, for instance, then we move it up to what's considered a tier 3. So tier 1 is regular classroom, tier 2 is an intervention block, tier 3 becomes, does a student need more intensive services one-on-one, for instance, or one-on-two? So we have reading intervention specialists in our elementary schools. So the students might be pulled for like a small group that consists of maybe 2 students that are working on the same learning gaps. So we intervene academics all the way at the grade levels. We need to strengthen our middle schools, I'm going to be honest with you, right? We've got a pretty well dialed in elementary, but we're realizing that we used to think we could get it all handled in elementary and can't. Those gaps still persist into middle school and into high school, so we are working on, again, providing the training and supports to our schools to be able to build those in. Then we also have the mental health area. So I was talking about that. So what do we do for mental health? This year, for the first time, we are actually employing a mental health screener. What does that mean? Because you will probably, if you have children in our district, you're going to get a notification that we're going to do a screener. That your child is not going to be pulled out of class. That's not what that looks like. It looks like a teacher sits down and they do a series of questions on every student they have in a particular class. And then based on those series of questions, the student gets a score. If the student scores in a range that says that this student is a student that we need to take a closer look at because maybe they have some internalizing behaviors to tie to that part about suicidal ideation, et cetera. That's kind of what we're looking for, internalizing behaviors as well as externalizing behaviors. Then we have intervention assistance teams at our school sites that then meet and talk about that. We notify parents. So we'll notify you before the screener is done, and we notify you if the results come back that we need to do interventions, or we're going to start building an intervention plan for your student. So we were doing that on the mental health end. Again, I talk about the fact that we actually do tie our students to clinical support services if needed. That's also done through that process. So if we're not able to meet the needs of our students within our school building with either the counselor or the social worker, and they need more intensive services, then we refer them for clinical support services. We also then have behavioral services. We look at the behavior. Those are more of the externalizing behavior sometimes, but we also put attendance in that. So we've, as a district, as a state, and as a nation, have seen an exponential rise on the number of students that are coming into schools, especially our littles, our kindergartners, first graders, who are really struggling to know what it looks like to be a student when they enter. We call them room destroyers. So they come in, throw stuff, break crayons, write on walls, climb up bookshelves, knock over desks, pinch their friends, and exhibit some very interesting behaviors. We've seen that all along, but you have maybe one student a year maybe that you're dealing with. Sometimes you have years that you didn't have any, and now many of our schools have 3 or 4 per school. And so we've been employing services, working with external providers for behavior specialists that come in and work with our schools. We've built what we term a BLAST program. Is at Mark Twain, and that is a behavior program where we're working with special needs students as well as general ed students to do intensive behavioral supports to try to get that student back into the general ed environment and learning those behaviors that we used to take for granted. Many of our students through COVID were put on iPads or computers or set in front of televisions and just literally did not learn the skills that daycares do a great job in providing, right? When a student goes into a structured environment like a daycare and they have to learn what school looks like in a daycare environment, but instead they're at home with mom and dad who are trying to work or are working, and then, Junior is given an iPad to entertain him or herself, and then she comes to school or he comes to school and we're like, no iPad for you. It's interesting the behavior that you see. So we're working with that. Like I said, we create behavior plans. We work with those students when we've invested a lot of resources into helping those students, because the hope is that we know as kinders, if we can really do intensive support, usually by the end of the year, we have right back. Right? They're very learners when they're little. They're just open, they're like sponges. So if we can get them really early with early intervention, we can get them back on the right track and get them regulated and and being able to work and play the way that the rest of their same age peers do. So those are things that we work on within our district. Sometimes I hear from parents. I just had a parent conference last week. School's not doing anything about this child. This child's destroying, my child's classroom. They've had to evacuate the classroom at least once a week for the last 12 weeks. Yes, that does happen. And we have plans that we then separate, put the students in another classroom so they can continue on their educational journey while we have addressed the students' behavior. So we see those, and then we see again, we've seen a big uptick in anxiety in our secondary students, and that's what we hear a lot. Is we have families that call us and say, Tasha is just too anxious to come to school, and so she's missing school, and that seems to be really, I think, the one area that just has become very difficult to try to figure out. I mean, I know it's one thing to say, yes, we're going to avoid making Tasha anxious by not making her go to school, but I'm not sure how we address Tasha's anxiety if we don't bring her to school and school work with her on coping skills, etc. So just saying those are some of the upticks that we've been seeing, but I want our families and our community members all to know that they are being addressed by the school. Sometimes it's not easy to see if it's not your child. You might see another child. We obviously can't, for purpose reasons, say to you, this child's on an IEP and this child has this child has this behavior, so it's coming in with them every day. We're not able to share that information. But please know that the schools are doing everything they can within their power to meet the needs of all students within that environment. So I wanted to make sure I hit on that so that so you guys know what that might look like. And then before we transition to questions, because I'm keeping an eye on the time, I'm not usually good at that, but I'm keeping an eye on the time. I do want to talk about, I think, some fun things, and that is what are some significant challenges, or big challenges, on the horizon for education? Christy, you talked about this briefly, but artificial intelligence, AI, right? Do I have anyone who wants to tackle AI in education, or at least some thoughts about that?
Well, it's already here. So there are some really good points, right? We are going to know things that we have never known before. AI in the fields of astronomy and electronics and those kinds of things. So there's an excitement, right? Because as you all can probably see, educators will really get excited about learning new things. And then there's also the component of making sure we roll it out in a way that we keep our educators and our students and everyone else safe. And so there's groups coming together to make sure that we glean all of the really good stuff that's going to come from AI, the increase of knowledge, and then also to make sure that we have some guardrails set up. And so that it's, what we don't want to happen is we don't want AI not to happen in our schools because the students, our digital natives, will find ways to do it anyways. And so we need to embrace it and make sure that it is part of a good learning tool. So that's the exciting piece of it. I did want to just pop back. She brought up some of the interventions and the work Carson City is doing to support students, and especially students with behavioral issues, with autism. Again, it depends on what entity or agency that you're looking at, but the amount of our students who are living with chronic illness, autism, diabetes, asthma, anxiety, has really increased. And so this program, that BLAST program, I get to go see it, and it really is about educating everyone in that school environment so they're not taken out. They're really educated right alongside of our students. And one of the most amazing things I saw is really empathetic peers. So maybe some of the students who were typically developing had a greater understanding with how to live with people that may be different from them. So I really saw that as a positive and, enabling our students who may be struggling with medical issues to remain in our school. So that's the exciting piece. AI can be helpful for them as well. AI, in the medical fields, maintaining diabetes to, all those good things, I think is going to be helpful for education as we go along. The other piece AI can really be helpful in is one of the key components that make MTSS work. And I'm sorry, I feel like I'm really nerding out now on education, but one of the key things that really make a difference in education is our ability to look at data to figure out what is working and what is not working. So one of the things we can use AI in really efficiently in government and in education, right, is a governmental task, is to make sure that our data systems have that AI component to learn along with us. And so I'm going to give you an example. We have a student information system that collects a lot of data on students, whether it's grades, whether it's demographics and those kinds of things. If we were utilizing some of these new techniques coming out, we could look at a school and say, hey, we have more of these kinds of learners here, so let's direct funds there to make sure that they're amply supported. So really making sure that AI is in our data systems to give us really useful data and how to use that data. Our education system is saturated with data. We want to make database decisions, but we look at data indicators. If you guys go on the Nevada report card, you can see some of that. It kind of gets overwhelming. And so to have up-to-date systems that help us process and analyze, give us good analysis of what that data looks like so that we can intervene earlier, like you were saying, I think there's some real potential there. So when it comes to AI, we are excited about the capabilities and what it could really mean for education, as well as making sure that we have proper guardrails set up and our districts feel confident about how to utilize that well.
I know very little about AI, but I know that when texting came out, I resisted it, and now I use it every day. Google, we were scared of that. We're using that every day. So like she was saying about the guardrails, our staff has to get up to speed, find out what AI is all about, how do we protect our kids, how do we utilize it in a productive way, where they're still thinking for themselves. So that's all I can say on the AI at this point.
Okay, I kind of had to put that plug in a little bit because actually the Carson City School District, in conjunction with the Nevada Department of Education, is putting on a community forum at 5:45 today. In case you didn't have enough of listening to us talk about education and you want to go to Carson High School and be a part of that, you're welcome. But no, I can tell you as a district right now, the number one thing we're doing is trying to put policy and regulation in place just to kind of guide that. We know that we need to 100% embrace AI in order to prepare our students for what comes next. Our teachers have embraced it. Our administrators have embraced it. ChatGPT is being widely used by our professionals, and it's just a different skill. It's actually one thing that we really, for instance, worked with our teachers on is, okay, so yes, you can give ChatGPT a prompt and say, write a one-page essay on this. But have any of you used it? It's not great. It's not awesome. It does an okay job, but it's not wonderful, right? So you still have to then go in, you still have to add examples, you still have to tweak it, you still have to give it voice. You can tell it was written by an artificial intelligence, right? Teachers, you can tell. So really it's a different skill, teaching kids how to take that, how to read it, how to determine, is this accurate? Is this actually answering the question that I gave it? Or how do I clarify what I'm trying to get out of it? There's just a different skill set that it takes to utilize it. So embracing that, working with our teachers so that they understand how it can be utilized in the classroom as a tool. Like Jason said, I remember back, I had an algebra 2 teacher when I was in school who refused to let us use calculators because she said, if the world comes to an end, you're going to be the group that has to rebuild the world. And I was like, if the world comes to an end, I don't think I'm going to worry about logarithms. But, right? The thing is, yes, you need to know the basic skills, but it's important for us to teach them how to use that technology that comes. It's not going to go away, so we have to embrace it. So our goal is to make sure our kids are safe, our kids are educated, that they know how to use it to build those guardrails. So that's kind of what we're jumping into the deep end of that. I will tell you one of the other things that I think is a challenge for educators, and we heard it just to tie back to the housing panel. Teachers do not make good money. I'm just going to tell you, in our state, pre-raises, because they just got 14% raises, yay. But like starting pay for a teacher in our district was $43,000. You can't even rent a one-bedroom apartment on your own. So trying to recruit teachers, especially from out of state, is a laugh when we go on recruiting efforts. And we're also like, wait a minute, if your median household income is $450,000, so I will never be a homeowner if I come to your state? Yes, but do it for the love of kids. Doesn't really go very far, right? Like that's, so we do need to work on that. It is a hard thing. It's a challenge, right? Or to say, you can come to Carson City and you can live in government assisted housing. That's still not a wonderful tool to get them here either. I mean, it might get you an apartment, but it has to be government assisted. So those things we need to continue to work on. I also, before I forget, want to say the sheriff's office, the most team in Carson Tahoe, they do work with us. They mentioned about how the work that they're doing in the school, so I did want to give them a shout out and say, yes, we do have those partnerships. Yes, they are working with schools, and yes, we desperately appreciate their support and help and what they bring to the table in terms of resources for us. So, before we turn it over to questions to our folks out here, is there any other parting remarks that any of you want to make before we entertain questions? No? All right. Do we have questions out there? Yes.
What percentage would you say are Medicaid eligible students?
That is an excellent question. Do you have that answer, Christy?
I don't have it right off the top of my head. If you would, let me see. It depends on what the community is. So Carson City has a significant, I believe it's over 50% of the population is on free and reduced lunch, which does tell you a bit about that Medicaid eligibility. Nevada is moving to a kind of like a dual enrollment program between free and reduced lunch and eligibility. You guys know your... Sorry, we're throwing it in the bus.
Yeah, we could get that number, but I don't have it off the top of my head.
As a district, I know we're well over 55%.
Yeah.
For reduced lunch. As a matter of fact, Ricky, you were actually mentioning what FRL has drastically increased for us over the past couple of years as well. I don't know if you still have that in front of you, but.
So it's a significant portion, especially here in Carson City. Dayton, Las Vegas has really high rates of free and reduced lunch and Medicaid eligible children as well. So it could be a significant source of funding.
We're excited about that actually, because as a district, we're one of the first districts in the state. We're not the only, but we're one of the front runners when it comes to Medicaid billing. Actually, Mr. Zona here has just accepted a position, so he's leaving his principal position at Pioneer, but he is our director of special projects with attendance and Medicaid. I don't know if that's the fancy name we gave you, but anyways, it works. It's brand new. So, but he's going to be working with our district to really increase the number of reimbursements that we see currently within our student support services or special ed department. We do Medicaid reimbursements for like speech, OT, PT, those types of services for Medicaid eligible students. So now we're going to be expanding that. So as Christy had previously stated, that some of the work that our social workers are doing, some of the work that our school counselors are doing, we've worked with the state to develop a platform called BH Works. BH Works is actually used in many states, but what our state's version of that looks like for our educators, so that it is a Medicaid it is a platform that's been approved to utilize for Medicaid reimbursement purposes. So we are beyond embarking on that. We're hoping within the next year that we'll start to see those funds come in.
Okay, yes.
I see Ronnie.
Oh, yeah.
All right, one question, Hope, one
Okay,
question.
well, Nikki's got one right after me. First, thank you all. I came through school when I was reading, writing, and arithmetic, and you gave us a lot to think about. I mean, this is crazy. But I'm glad to hear it, because I need to know. If the community could help, and you cited some stuff, what would that help look like? That's my question.
I think just support for the increases in educational funding. I think, like I said, we hear a lot, about the governor's facing accountability expectations. And in my opinion, right, they focus a lot on increased academics, which are important. But it is not paying enough attention to all the other things that we are doing. As I said, it's one thing to say, yes, every child needs to read by grade 3. That's true. That's 100% true, and we all want that. But there are these other things that are occurring. So just to base whether or not we're getting the job done by a test score is not representative of everything we do. So understanding that, supporting the fact that yes, we do need to have, because we are asked to do all of these things, which we need to, and I understand that who else is going to do this? Who else is going to be able to pick up those pieces in the way that we can, because we have the kids 180 days a year for 7.5 hours a day, so we have them almost as much as their parents, probably more than their parents in wakingness, right? So it makes sense for us to take on that responsibility, but we need funding to do that, right? So we need that continued support on that end.
Anybody else want to, go ahead.
So, shameless plug here. So, if any of you all or anyone you know, either an adult or a student that wants to become a teacher, we have a pathway for that. So let's say you're retired, you're getting kind of bored, you've got a degree in your back pocket, you always thought maybe you'd like to teach, we have a pathway for that. So we align you with experienced teachers through an apprenticeship. You could start teaching next year. So really, help us spread the good word that the teaching profession is an amazing and something that Nevada really needs right now. And so, if you can help me get the word out, that I think a lot of people think that the old-fashioned way of becoming a teacher took years and years and years. It does take a while, but we have kind of lifted some of those barriers and working really hard with our Nevada higher institution agencies to pair along of our teacher apprenticeships to get qualified adults into our school systems.
All right, thank you, Christy. How many people are going to go get their teaching degree now?
Come on, everyone.
It's rather complex, I'll tell you what. You have to be a mother, father, brother, sister, pastor, whatever. So thank you all for being here today. Thank you guys, very enlightening. As you saw with most of the panels today, there's good news and there's not so good news. But what we were trying to do today as a chamber is we're not telling you what we think. We're just trying to be as neutral as possible to allow you to understand the situations a little bit more, because we tend to have a mindset, and this mindset may not be the reality. So that was our purpose today. And thank you all who have been sitting on your butts since 11:30 or whatever, and listening to all this, and I hope that you got a lot out of it. And I'm not sure if we should do this again. I don't know about you, but I'm so darn depressed right now. So, but anyway, thank you all, and the panel, I guess, will stay another few seconds if you want to talk to them. So thank you all for coming.